Today, I will discuss the importance of workplace safety and health. Workplace safety and health are a vital aspect of any organization as they should ensure the well-being of employees. Regulation in many countries mandate safety standards to create a secure work environment. Conducting risk assessment to identify and evaluate hazard is fundamental in preventing accident and illness. So, when introducing safety and health at work, it's initial to highlight the following concern or example, which is statistics. Start with some statistics on workplace injuries or illness to emphasize the significance of safety measure. Second, cost. Discuss the financial impact of workplace accident on both the organization and the affected employees. 3. Legal consequence. Mention the legal implication of not complying with safety regulation, including fine or legal action. Last, productivity. Address how a safe work environment can enhance productivity by reducing absence due to injuries. Last but not least, employee well-being. Empathize how prioritizing safety and health at work show care for employees' well-being, leading to higher moral and retention rate.
Accidents at workplace occur due to the nature of jobs, typically manual and hazardous, in construction, plantation, and manufacturing. Other than that, miscommunication and language barriers make it difficult for these workers to understand safety manuals and written instruction. Accident can be categorized by the impact and severity described as. The first one is near miss or close call. It's an unplanned event that has the potential to cause, but does not actually result in human injury. Next is non-fatal. This type of accident not cause death. Non-fatal work-related injuries such as falls, being struck or crushed by objects, electric shocks, or assaults. Last but not least is fatal. This type of accident causing or capable of causing death.
Okay, let's move on to occupational diseases and other health issues. Occupational disease may be more difficult to identify and treat as they may emerge over a long period and sometimes long after an employee has left the job. Common health hazards come from chemicals, fumes, dust and smoke, radiation, infection, noise and vibration, and also extreme temperature. To prevent the problem, employee must wear suitable masks, use and wear a suitable PPE, use an earplug or ear cover, and stay hydrated and wear suitable clothes. There has been extensive research about the use of computer and other electronic devices can affect two employees' health, which are carpal tunnel syndrome, computer vision syndrome, which is eye strain, and musculoskeletal problem. The first one is the carpal tunnel. It is a narrow passageway surrounded by bones and ligament on the palm side of the hand. When the median nerve is compressed, symptoms can include numbness, tingling, and weakness in the thumb of fingers. The next one is computer vision syndrome. Is a condition resulting from focusing the eyes on a computer or other display devices for protracted, uninterrupted periods of time, and the eyes muscle being unable to recover from the constant tension required to maintain focus on it. Musculoskeletal pain affects bones, joints, ligaments, tendons, or muscles. An injury like a bone fracture may cause sudden, severe pain and underlying condition like arthritis. The prevention for the problem is, and the employee must practice the ergonomic position while working on their office desk. Use adjustable screen, ergonomic chair, or adjustable chair. Change the common keyboard to the removable keyboard can decrease the carpal tunnel race because you won't stay in the word and same position in a long time. Use the glasses that include the UV or blue light protection while on the screen to prevent eye strain.
There's two requirements to ensure a safe workplace, which is safety policies and safety program.
Safety policies is a legal requirement that in Occupational Safety and Health Act OSHA 1984, which is enforced by the Department of Occupational Safety and Health (DOSH) to encourage employers to focus on safety and health in the process of devising the policy. Safety policy is mandatory applicable to every employee and self-employed who are half sick and above employee, which is stated in OSHA 1994, Section 16, Regulations 2. In bracket exception, Section 16 of the Act shall apply to every employer and every self-employed person except those who carry on an undertaking with not. Most safety policies include a statement of organization commitment to providing a safe and healthy workplace, an explanation of who is responsible for safety in the organization, which is all employees.
For safety program, it must include total commitment from all levels of employees, starting with top management. Next, the appointment of specific persons to take charge of safety and health issues, a system of keeping and analyzing records, extensive training, awareness campaigns for workers, incentive and reward schemes, provision of personal protective equipment, and lastly, disciplinary systems. Next, total commitment from all levels of employees are senior management, responsibility for safety, and individual workers. Total commitment from all levels of employees includes senior management and responsibility for safety. For senior management, it provides an adequate budget for safety and health activities, chairs safety committee meetings, it attends safety activities, and be a role model, comply with all safety regulation all the time. Responsibility for safety. OSHA, SHO 1997, Section 18, Regulation 3. Hazardous industries are required to employ safety and health officer SHO. It is mandatory for construction companies project worth 20 million having more than 100 workers. It is also mandatory to establish the SHC if having 40 or more employee or on the instructions of the director DOSH. The meeting must be held at least once in 3 months and it must be minute bookkeeping record in period of 7 years. Role for individual workers. He must take reasonable care of himself and other persons, cooperate with employer or any other designated persons. He must wear or use any protective equipment or clothing provided by the employer. He must comply with OSH instruction or measure instituted by the employer. Failure to comply may result in penalties of up to 1,000 or imprisonment of up to 3 months, stressing the critical nature of both employer and employee adherence to safety regulations. Record keeping. It highlights the legal obligation to notify the Department of Occupational Safety and Health (DOSH) as per OSHA and ADOPOD 2004. Employers must also report related incidents to the Social Security Organizations (SOCSO). The records, including those of occupational diseases, are retained for 5 years to analyze causes and develop future preventive measures. Accurate and timely record keeping is essential for ensuring compliance and improving safety protocols in the workplace. This slide illustrates the implementation of safety and health campaigns, which aim to raise awareness and educate employees about workplace safety. Campaigns are accompanied by hands-on safety training sessions, such as first aid training, to ensure employees are equipped with the necessary skills to respond to emergencies. Such initiatives foster a proactive safety culture, equipping employees with knowledge and skills to prevent accidents and handle incidents effectively. This slide focuses on promoting workplace safety through two key strategies: one, an incentive and reward scheme, and the provision of personal protective equipment (PPE). For disciplinary systems, they take discipline action toward whoever did not practice OSH at work.
Sexual harassment at work. Sexual harassment at work can be defined as any unwanted conduct of a sexual nature having the effect of verbal, non-verbal, visual, psychological, or physical harassment. Sexual harassment has two categories. The first one is sexual coercion, whereby one party uses work-related power to force the other to give in to his or her sexual demands, known as quid pro quo harassment. The next one is sexual annoyance or a hostile work environment. Sexual harassment that has the effect of unreasonably interfering with a victim's work performance or creating an intimidating, hostile, or offensive working environment that affects the victim's psychological well-being, called also hostile environment harassment. The impact of sexual harassment. The negative effects of sexual harassment has 4, but we have more than that. But I will give only 4. The first one is physical and health issue for victims. The next one is psychological stress for victims. Next is economic losses for victims who may resign their jobs. Last is moral problems. Next one.
My name is SUSHILAWATI, and now it's my turn to present my part, which is violence at work and improving the health of employees. First, let's start by addressing violence in the workplace. Violence at work can take many forms. It can be both physical and psychological, with the latter often manifesting as bullying. Unfortunately, many employees face such issues, which can lead to serious emotional and mental consequences. Firstly, it's crucial to assess situations where violence is most likely to occur. For example, in manufacturing settings like Rodwa, stressful production deadlines or interpersonal conflicts between team members should escalate if not properly managed. Other than that, it's important to establish strict rules prohibiting violence. These rules should cover both physical and psychological violence with zero tolerance policies. Next, making contingency plans to deal with violence is another step. For example, at Rodwa, having a clear chain of command and immediate reporting channels for violence or threats will ensure swift responses. Lastly, training employees to deal with violent situations and prevent escalation. Training sessions can teach employees how to recognize early warning signs of violence and provide them with the escalation techniques. Now, let's see several strategies that companies can implement to improve the health of their employees. First and foremost, one of the most effective ways to do this is by implementing wellness programs. This can include fitness challenges, health screenings, and mental health resources. Other than that, stress management. Many employees face heavy workloads, tight deadlines, and long hours, which can lead to chronic stress. To overcome this, companies can offer support such as counseling services, meditation sessions, or flexible working hours. Next, reducing drug and alcohol-related problems. Providing access to confidential support programs for employees struggling with substance abuse can improve workplace safety and employees' health. For example, implementing policies and offering help early. In addition, focusing on ergonomics is also key to improving employees' health, especially for those working in environments like offices or on production lines. For example, proper seating, desk, and machinery setup reduce the risk of injury and promote comfort. Last but not least, the COVID-19 pandemic has reshaped how companies think about employees' health. Companies now have to consider measures such as sanitation, air quality, and flexible work arrangements to keep their team safe. For example, encouraging sick employees to stay home, providing access to vaccinations, and ensuring social distancing measures in shared spaces.
So the conclusion for this workplace safety and health is prioritizing workplace safety and health is vital for creating a productive and positive work environment. By implementing effective policy, conducting regular risk assessment, providing comprehensive training and authorizing preventive measure, organization can significantly reduce workplace hazard. This commitment not only protect employees but also boost morale, productivity, and overall organizational success. Upholding health and safety standards is not just a legal obligation but a crucial responsibility that benefits everyone involved. Thank you.